In the Orangeburg-Calhoun area, some residents say it would be quicker to find a place to buy hay than you would care in the emergency room.
I've literally seen where they've had to wait 10 to 12 hours sometime in order to get treatment.
The regional medical center that serves 4 rural communities in the area hosted a town hall meeting Wednesday to address community concerns about access to health care. Keisha Watson has lived in Calhoun for 40 years and says finding a place to get medical care has always been a challenge, like a needle in a haystack.
A lot of people don't have transportation, so they're depending upon the EMS to pick them up, and sometimes they're far stretched depending on the nature of someone else's health condition and how far out they may be.
At the last town hall meeting back in June, the hospital encouraged people not to go to the ER, explaining that a large chunk of patients that come in see them for routine medical care, not actual emergencies. The hospital asked people in the community to go to Express Care or see a town clinic they've set up like Santee Care. But we found that Express Care and the Santee Clinic were each closed for more than a week in August and several days in July as well. Sabrina Robinson, the CEO of operations for RMC, explained that the closures are due to staffing shortages.
We've lost some providers in those locations, so now we're still looking for a full-time provider in our Santee location, but Express Care, we just hired our full-time.
The hospital says if care is needed on a day that the recommended clinics are closed, that patient should either use the hospital's telehealth system or find a primary care physician outside of RMC. But the Regional Medical Center hopes these won't be the only care options for long. CEO David Sutherland says that a partnership with MUSC will hopefully farm a chance for their more rural patients.
Our purpose is to get better every day. It's a challenge in the healthcare world today.
Reporting in St. Matthews, Peyton Lewis, News 19 WLTX.